Hi everyone. The demonstration today I'll be doing is moist heat therapy. So before we get started, you want to make sure that you check your doctor's orders, review the procedure in your policy procedure manual, ensure that you've done proper hand hygiene, and when you get to your client, you want to ID them. So what I'm going to do is I'm going to check their armband, I'm going to ask them their name and their birth date, and I can verify that with the name on the band. I also will ensure that my bed is at a working height, that I've communicated to my client what I'm about to do, and that I've made sure that we have privacy. For this procedure, I'll be using medical aseptic technique. So in this scenario, my client had a IV in place, and the IV went interstitial, and also the vein that the IV was in got inflamed and created a phlebitis. So just an inflammation along the vein. What I'm going to do is I'm going to do a survey and assessment of the skin. I'm going to document what I've seen later in the interdisciplinary progress notes. So here, the area around that vein's reddened, there's a little bit of swelling, and the patient complains that the site is a little bit sore. The skin's not broken, so it's still intact. The physician has ordered moist, warm compresses to apply to that area 3 times a day. So for this procedure, I've gotten a waterproof pad, some gauze, warmed normal saline, and a basin. I'm first going to look at some of the benefits. So what are the benefits of this treatment? So basically, with the warm compress, it's going to go deeply into the skin. So it's going to penetrate that vein, and hopefully that increased metabolism and heat that I'm applying to that area is going to help it heal a little bit faster. The one thing about moist heat therapies is it can macerate the skin, so it can make the skin sort of soft and fluffy. And then as well, it also increases the risk for burns because water conducts heat. I'm going to assess my client's tolerance to this procedure. So here I'm going to look at age. So very young and very old will be vulnerable to things like burns. I'm also going to look at sensory perception. So does the person have good sensory perception in that arm? And then as well, I'm going to make sure that I'm not putting this on anything that has active bleeding because that'll increase bleeding. And if the client had any medicated patches, I would not be applying this on the medicated patch because it could cause the medication to absorb into the skin a lot faster. Conditions that might cause risk to my client. So if my client has a cardiac condition, using heat therapies can cause changes in vital signs such as blood pressure and pulse. If my client is diabetic or has peripheral vascular disease, it increases the risk that I could cause burning to the skin. So I want to check those as well. I'm going to educate my client about this treatment, some of the signs to look for if something's happening that shouldn't be, and I'm going to make sure that I have the call bell close by if they need it. So here I'm just going to take my gauze, I'm going to open it up. You only want to use enough gauze to cover the area in which you want to treat. So we don't want to be placing this over too big of a surface area because the heat doesn't need to go there, right? It just needs to go in the area you're treating. I might want to check this on the inside of my wrist just to make sure that it's not too hot. I'm going to put a pair of gloves on just to protect my hands so they don't get wet. My waterproof pad I'll place underneath the client's arm. I'm going to take my compress, wring it out, place it on the area that I'm treating, and then I'm going to wrap it up. So wrapping it just ensures that it doesn't cool off too quickly. I'm going to set a timer, and in 5 minutes I'm going to come back and I'm going to reassess. So basically what I'm going to do is I'm going to remove this, peek underneath the pad, see what the skin looks like. Is it overly red? Does the client complain of too much burning? If the pad feels like it's lost some of the heat, I'll go back and I'll add some more fluid, rewarm my pad, place it back on my patient, and wrap the back up again. I'm going to do this every 5 minutes until the completion of the treatment, so around 15 to 20 minutes. And once the treatment is complete, I'll take this off completely, dry off the arm, and do a reassessment of that area. So again, I'm looking to see how well the treatment worked for what I was trying to do. So does that area look any better? Does the client complain that the pain is a little bit less than it was before? And then once I've done that, I'm going to document all of this in the interdisciplinary progress notes.